Welcome to Below the Line with Dr. Bennie Harris. The Chancellor of the University of South Carolina Upstate talks with top leaders about issues such as change, technology, education, and leadership. Please enjoy.
Clarence Sevillian is Prisma Healthcare Executive Vice President and Chief Operating Officer. He oversees all operations for Prisma Health Acute, Medical Group, Ambulatory, and Post-Acute divisions. Clarence came to Prisma Health from McLaren Healthcare, this fully integrated healthcare delivery in Michigan and Ohio, an employed physician network, commercials and Medicare HMOs, and the Michigan's largest network of cancer centers. He served as president of McLaren Northern Region and president and CEO of McLaren Bay Region. In these roles, Clarence helped position the system towards a population health strategy while leading the expansion and integration of services and facilities for 6 of McLaren's hospitals. His career began at McLaren Regional Medical Center in 1998 as a staff physical therapist. Over 2 decades with the system, Clarence served in numerous leadership roles. These roles include Director of Business Development, Vice President of Operations, President and CEO of McLaren Oakland, and President and CEO of Dr. Hospitals of Michigan, where he oversaw the organization's 2008 transition from North Oakland Medical Center to the majority physician-owned DHM. Clarence earned a bachelor's degree in mathematics from Vanderbilt University, a bachelor's degree in health science, and a master's degree in physical therapy from the University of Michigan, Flint, and he earned his MBA at Lawrence Technological University. Clarence, I've practiced your wife's name, so I'm going to try to do it again. He and his wife, Artika, have 2 adult children, Akidra, and Alexis. Passionate about sports and fitness, Clarence believes in leading by example and always connects to his purpose, which is to always make a difference and advocate for the health and well-being of the community. Clarence, you are an overachiever, and welcome to the bottom line.
Thank you for having me. A pleasure to be here, for sure.
Thank you very much. Thank you so much for sitting down with me today. I understand that your career began in healthcare, which I've provided in my introduction, in 1998, when you were a staff physical therapist at McLaren Regional Medical Center. So what drew you to that particular career?
It's kind of interesting. I tell you, when I'm a young, energetic kid out of school, and I had my eyes set on going to college, I thought I wanted to be a corporate lawyer.
Okay.
And I went off to college, and that first semester, that quickly changed. I got into my first poli-sci classes and said, this is not for me.
Okay.
Quite honestly, at that time, I didn't know what I wanted to do, though. It still wasn't clear to me. So I sat down and talked to some counselors and folks and just tried to better understand, kind of giving me some direction at that time. And they said, what do you like to do? And I said, well, I like math, but I don't want to be a teacher. Sorry. I don't. My parents are in education, but I knew I didn't want to be a teacher, and I didn't want to be an accountant, but it wasn't clear to me. I said, don't worry about it. Problem solving, analytical thinking. You can branch off in anything that you wanted to do. And so that's the math major, and pursued that. Because, again, I didn't know what I wanted to do. I was fortunate enough to play some sports at Vanderbilt. I played football there, and through my career, I may have had an injury or two, which required me to have some athletic training and some physical therapy along the way. And quite honestly, by the end of my football career, that's where it became clear to me, is that I knew, being a purpose-driven individual, that I knew what I wanted to do, and I wanted to make a difference. I wanted to help people, and that's what really said, well, putting that together with wanting to help people and make a difference, and the experiences that I had through the athletic training and physical therapy, my introduction was into healthcare was to become a physical therapist.
And what's interesting, I have one of my questions here is, have you always been interested in helping people? And you just said you want to help people, but give me some color to that.
Yeah, I again, as I kind of just share with you kind of my natural progression up to that point, it wasn't clear to me, and I guess it wasn't deep down. I would say it probably was there, but it became very clear to me by the end of my junior senior year of college that it became very clear to me that I truly wanted to help people at that time.
Okay. So you went from physical therapist to executive at McLaren, and you moved steadily up the ranks. What made you step away from PT and onto the leadership track, other than money?
At the time, it really wasn't that. But I would tell you what it really was, and kind of going back to I wanted to help people make a difference. It was actually my physical therapy career. So following through that journey, before I got into PT, when I got into PT school, I actually had to do some volunteer work. And so my first introduction, I had to go to my local healthcare company, which was McLaren at the time, to do a volunteer opportunity. And in doing so, we hit it off when I did that volunteer opportunity. They said, you know what, there was a shortage of physical therapists at the time. And because of that, if you sign on us for 3 years, we'll pay for your school. Mm-hmm. I said, let me get this right. I have a job at full paying rate when I come out, and you're going to pay for my school? And I said, yes, absolutely. And so I thought I was going to be a sports physical therapist, and that just wasn't the case. When I got out, the only position they had available was on the inpatient rehab unit, where the course of my life changed. And it truly changed, where I thoroughly enjoyed the clinical side of things. But one particular patient, his name is Mr. Smith. Never forget it. 76-year-old, had a severe stroke, flaccid on one side of his body, came down into the therapy gym, and signs and symptoms of a severe stroke. Mm-hmm. And Mr. Smith, I'm a young, energetic kid saying, Mr. Smith, my name is Clarence. I'm going to work with you over the next couple of weeks. You can expect X, Y, or Z. And he looked at me, Benny, and said, kid, get away from me and let me die.
Wow.
And obviously they don't teach you this in school of how to handle that, but I knew that I couldn't obviously let that happen. Same message for a period of 3 days. Fourth day I was able to break through with Mr. Smith and do some passive range of motion, build a rapport with him. And to make a long story short, Mr. Smith walked out of there with a quad cane 2.5 months later. Wow. And I was like, wow. I love it. I mean, that's why I do what I do. But it didn't stop there. I'm actually cutting my grass on Saturday morning, and up and I look, and guess what I see? I see Mr. Smith.
Mr. Smith?
I did. Okay. Yeah, he's actually walking with his wife on the exercise program that I put him on, this time with a single cane. His wife's eyes met my eyes, and she ran up to me, sobbing, crying, gave me the biggest hug you can ever imagine, and just said, Clarence, thank you. Mm-hmm. Look what you've allowed us to do because you didn't give up on us.
Yeah.
And that's where my life changed. At that point in time, and I kid you not, I have chills on my body right now telling you that story, but I said, I need to have an impact like this in a larger way. Yeah. And maybe it was the sports, the team, and those sorts of things that allowed me to do that. But I immediately made it my goal to become a hospital CEO. And that's where it actually changed for me, because I wanted to treat everyone like it's my mom, my dad, a loved one. And if you come into our facility, that you have that personal touch. And I wanted to work through a team to create that. Yeah.
I think I told a couple students that they was trying to figure out what they want. I said, if you do what you love, what you're passionate about, your purpose will become clear.
That's exactly right.
And so I think that's what I see happening here.
Yes.
So you oversaw Doctors Hospital of Michigan in 2008, transitioned from a majority physician-owned institution. What lessons did you learn in that whole experience?
Well, that was my first CEO job.
Okay.
So I would tell you I learned a ton through that experience. I think the two things that I'd point out would be the importance of alignment with your team. And if you can only imagine, the importance of alignment with the team and the importance of preparation. Those two things I think are the two my takeaways from that experience, amongst other things. But you think about getting a group of physicians that have the majority physician ownership. And physicians are very bright, smart individuals, very purpose-driven, very passionate about the things that they like, want, need to see. They hear it from their patients. And trying to align that with, now you're a for-profit entity, you need to make an operation run where it hadn't been in the past. And understanding what their goals were. Again, we always want to put the patient in the middle.
Yeah.
So aligning our goals were something that had to be strategic, and so what goes along with that is your important communication skills, but also sitting down and having a good understanding from all parties of what should happen, what can happen, and what's going to work the best. So I think that was one of the takeaways, and the other one was preparation, and that is when you go to a physician, you go to the state, you go to CMS, which is our Medicare, Medicaid, and tried to redo things because we actually started up a new hospital that you had to be prepared and have the information correctly, and you need to be prepared to tell your story during that period of time.
Yeah. So I found it interesting when you said put this patient in the middle. It was very much like a servant leadership model.
Yeah, absolutely.
When we talk about patient, the customer, the client, et cetera. So we talked about being, I've heard a lot of talk about precision medicine, et cetera. But I know as I read your bio and some of the things that you do, there's a lot in there about population health. And talk to me about how that strategy improve a targeted population with health and equity, et cetera.
Yeah.
And then before you go, talk about precision medicine as well as it relates within the context of population health, if it does.
Yeah, well, I will. And so when you think about population health, that term gets thrown around a lot.
Yeah.
And it's a broad term overall. At the end of the day, when we're thinking about population health, what you're really trying to do is really create an ownership amongst the patient, the healthcare journey, experience, et cetera. You want to enhance the health and well-being. Along with that journey, you want to reduce cost of your healthcare experience and try to have some efficient interventions that go along with it as well. Ultimately, you want to improve the care, the quality of care that's being delivered through that experience, and trying to create more of a wellness proactive strategy that's going to help overall as well. And if you think about that, there's many things that go underneath it. So when you talk about promoting, a healthy diet or an active lifestyle, those things are extremely important as well. But what also is important, we do a very good job of, if an individual comes into our four walls, our emergency department and the surgical procedures, we do a really good job with that. The things that we had to improve on was, our community partners. And you think about a lot of your social determinants of health. They play an extremely important role in the overall health outcomes of a patient. When we talk about health equity, health and equity, what that means for truly looking at the person as a whole. The care management that goes along with that as well. So not just looking at when you show up in our doors, but what's happening outside of when you leave the hospital. That's when I truly embrace and look at what population health can really do for a community overall, because you not only are creating that engagement and that ownership of you as a patient in that healthcare journey, but as we as a healthcare system start to look at that patient more broadly, outside of just an acute care illness, but looking at, when they go home, do they have a grocery store? Do they have sidewalks to have in their neighborhoods? Do they have transportation to be able to go get their medications? That's the types of things that we have to look at when we think about population health.
So you look at the whole ecosystem of healthcare and of the individual, where you focus and centered around the
Absolutely.
Okay. That's great. Do you think AI and all of the technology now is going to help?
It's going to help out. I think it's going to help tremendous. And AI, another broad term, but really, really can be instrumental in providing that. When we think about what our purpose is, what we should be doing, and where we often go wrong, is we haven't really built the trust with the patient. Yeah. Right? And so when I think about what our goal should be, is how we continue to build trust with our patients, so they trust the physician that they come into, they trust the healthcare organization that they're entering into. And if you bridge those gaps, it's going to be a much better health experience for the patient. And at the same time, it's going to help the healing of that patient in a more holistic way, because they're going to be compliant. So when I think about how AI can help with those sorts of things, when you think about things such as, you can do some predictive modeling of when you're going to have created better access for your patient experience, and how you look at, you can understand if you have a tumor growing based off of certain things that are happening. There's some AI that's happening in the background that helps us predict a lot of those things, and it's far stretching, but it allows us to really understand how we can better connect with our patients. And so, when we think about that and bring in some of those digital things such as self-scheduling and what have you for our patients, they have ownership of it, they become more engaged with it, and there's going to be a better compliance and outcome as a result of it.
I can assume in your role as Chief Operating Officer that you have to think about those type of things, how to improve the whole system of care for your patients and all of these things, even how you utilize AI as well. Is there anything from population health strategy that you think could be applied to educational institutions?
Oh, absolutely. When I think about the role of education and just looking at preparing for future healthcare workers as an example, it's extremely important. Education plays a crucial role for equipping our future healthcare workers, as an example. Just in having the necessary knowledge and skills and the things that are going to be helping prepare them, whether it be population health or other healthcare areas. Creating a diverse background is extremely important, because that's going to fit into what health equity types of things that we need to address. So, that helps build trust as well when we think about that. Having programs that are available is extremely important as well. So folks can have exposure to, students can have exposure to, and understand that, no, it's not just about being a doctor or a nurse, but there's other things that are in the healthcare arena that they can play, that plays a huge role in healthcare. So promote student learning opportunities, as an example, going out to, in the community and, promoting that. Where they can have exposure to a lot of these things when we talk about social determinants of health, when we talk about creating partnerships, because trying to make improvement in healthcare by itself and thinking that a healthcare system alone can do that is a mistake. It needs to have community partnerships. So a huge role in terms of trying to address that.
Yeah. Now, this is a lighter question.
All right.
What do you like best about your job? What do you like?
There's so many things that I love. I will tell you, I've been at Prisma Health for the last 2.5 years, and I would tell you the thing that I like most is in the team that we have to be able to accomplish all the things that we're talking about today. Okay. And so when we talk, if I say that I think, Clarence Sevillian can go out and move the healthcare needle in the state of South Carolina by himself or with Prisma by himself, the answer would be absolutely not. Okay. It's a team approach. And so the team that we've been able to develop and to work with that team, again, maybe that's the football portion of me, of that team side of things, and to be able to do that, again, with keeping that patient in the middle, it is what brings me to life. If I have a bad day, Benny, I will go over to the hospital, round with the patient just to lift me up. So seeing that, but then also working through that team to get the measurable outcomes, and that is, are we moving the dial of healthcare in the state of South Carolina? And the answer is yes, because of these things that we're addressing, and to know that we put that patient in the middle and that we're actually having an impact. Because, and remember, I go back and I'll say, treat everyone like it's my mom, my dad, a loved one, and that we want to see that kind of outcome. That's important. Yeah. And that's what I enjoy the most, in seeing those things and seeing the partnerships that are being developed so that we can have that kind of an impact.
You have communicated a type of care that's really not in textbooks necessarily. It's like you can't give a person a series of things to memorize. So how can higher education institutions do a better job at preparing students for the job market, particularly the healthcare job market?
Well, it's a very, very interesting question, but some of the things is, you really can't, when I went into healthcare, I was like, when I developed my mentor and said, well, how do I do this when I got my first management job? And he said, there is no playbook. There's no playbook for it. You can go to Joint Commission standards and understand what you should be doing in a hospital, but there is no playbook. I think the things that we all can do in education can certainly help is, just expose, get exposure to all the different things that, there is in the healthcare. And you think about it, there are doctors, there are nurses, yes, but there's technical positions, there's administration positions, there's therapeutic, clinical positions, there are environmental services or food nutritional services. And you take any of those cogs out of that wheel, you have nothing in the healthcare system. So the more exposure to those types of things, and understanding that folks have to have a certain level of empathy when they go into it, and understand that it's not about just being black and white. It's about having that creativity and that color to it that's going to allow them to excel within that environment.
So it's clear through the conversation we've already had and some of the things that I know about you, that you're passionate about sports and fitness.
I am.
So tell me more about that and about how you try to lead by example and how this plays out in your life and and influences of others?
So I think sports is, I encourage any youth that I talk to today that I think sports, you may not be sports minded or have the athletic ability, but I think it's extremely important because it teaches so much more than just that sport.
Okay.
Right? You think about an individual waking up every single morning, going to practice, and having to balance their homework in between that sport, that activity, that practice. It teaches that kid discipline, hard work, ethical responsibilities. You think about all the things that it brings to an individual to make them more well-rounded and wholesome. I think is extremely important, and it teaches them that through the course of their career. And so when they think about entering that career, it makes them more, I would say, well-rounded as a result of it. Me personally now, having gone through that, the maintaining the fitness side of it is extremely important to me as well, because, you kind of practice what you preach with it, and understanding that it is an important piece of everything that we talked about with population health or you as a person. But me personally, on the lighter side, if I didn't get my workout in the morning, I'm totally affected throughout the day. And so it allows me to be grounded, have a certain, it gives me a certain level of respect to, what it is that we're doing. And it really humbles me in starting my day.
For me, I need that accountability. I just hired one of my students to be my trainer.
To get you on the track, huh?
I've been training, and now I think the mistake I made is that he's a bodybuilder. And so what he aspires for is not exactly what I aspire for. So I'll stay at it for now, but thank you.
But you think about that, though, and I'm sorry for cutting you off,
No,
but it's sometimes you have to have that motivation, and it's always sometimes good to work with a partner to help you hold yourself accountable.
It's accountability.
It is. It truly is.
So it's been said that you are good at building a culture of trust and connecting through communication. What is your sense of how important those two things are in leading any division or organization?
I think it's everything, to be honest. So the level of importance for building trust and building a culture of teamwork is pretty much everything. Anything, especially in healthcare, when you think about what it is that we do, is very easy to get distracted. Truly, think about how you build that trust, and that level of transparency is extremely important, because take COVID as an example. Through COVID, the COVID period, probably the toughest time of my entire healthcare career. Because all you're doing at that point is you're putting out fires. You're dealing with a crisis at that point in time. And so things get lost sometimes when you think about strategy, growth, vision, financials, budgets, and all those sorts of things. And the more transparent that you can be with your team and helping them understand all the moving parts and pieces of that, the much more, the better team that you can create. So you've built up that communication, but in doing so, you've built that level of trust. The same thing I'm kind of sharing with you about the importance of the patient and building teams around, trusting your people to do the things that they do, delegating when you need to delegate, improving those communication skills. It all builds trust at the end of the day. And I think, that's your credibility. And when you're trying to do that next most difficult thing, and there will be another difficult thing that we have to address, you've earned that trust to be able to get that team to move in the direction you think they need to move.
Okay. Thank you. I would like to talk a little bit about the whole theme of these series of conversation, which is leading below the line. And I coined that because for a number of reasons. Oftentimes people have conversations, and a manager has an employee that they're working with and can't figure out how to move the needle to be more productive. And oftentimes there's something going on below that line that is not being talked about. So you may think you're addressing one issue, but the real issue is below the line. Applying upon that concept for a few minutes in terms of when you think about leadership and trust, communication, and leading that space where people don't always say what the real issue is that they're concerned with.
Yeah, absolutely. And I think you hit a really important point there, because oftentimes as managers, or leaders in the organization, you're just focused on the things that are out, your goals for the year. But you've got to bring your team along. And I tell folks all the time is that, when it comes time to discipline an employee, and you say, don't come to me and say, I just want to get rid of them.
Right.
I don't want to get rid of them. Well, what have you done up to that point? Have you sat down during the evaluation and had that open, honest conversation about what you feel, what it is that they feel, what are the things that are important to them, and it shouldn't just happen at one time a year during your evaluation. That should be something that should be cyclical, and you're doing that on a regular cadence to better understand, what's going on in your employee's mind, or what's going on in yours, so that you can have clear direction. And if you don't have that clear direction, you can sometimes waver from where you need to be. So the point I'm trying to make is that it's extremely important to be sitting down with your team members, or an individual that maybe they're I'm not going to say failing, but there's an opportunity for improvement, or maybe they're excelling. On both sides of the spectrum, it's important to sit down with your team to let them know, you're doing great. These are the things, and giving specific examples of how they're doing great. But there may be an opportunity where they're not doing so great, and sitting down with them and understanding, and again, the importance of that, building that trust, because you've had those conversations, you're open, honest, transparent about the conversations that you are having. That will tend to allow that individual to open up and welcome it. So don't operate or lead by fear, but lead by an example. And so having those conversations are extremely important.
And I appreciate that, because what happens is when you don't have those conversations, when trust is not there, people are not as transparent about what they're really concerned about.
That's right.
And as a leader, you really can't address it if you don't know the real conversations.
It's interesting. I had just a meeting just Monday, with an individual, and it wasn't a bad guy. It was actually a good conversation. But this individual's like, what are my next steps? Where am I going from here? And because they're performing well. But if, as an example, if I would just I'll get to it, or I didn't address it, what does that do for that team member? It kind of deflates them. So again, just sitting down and first they felt comfortable having the conversation,
which is a good thing,
right? They so oftentimes they don't feel open to that, but the next part of that is you can have an open dialogue at that point in time, and understand you do have to be patient. This is what my goals are as helping you develop, and these are some of the next steps that I have. But ultimately, where do you want to be? 10 years down the road, and then you can help them through that journey.
I think oftentimes I looked at that as having shared aspiration, understanding what your employee aspirations are, he or she understanding what your aspirations are, and you have these shared aspirations. So this is another softball question for you. The heavy stuff. So have you worked with mentors over the course of your career? And have they helped you?
Well, I'll go back to my remember my original comment about the answer is yes. And several. There wasn't just one, and I can think in this particular case when I started my career, when I said I wanted to be a CEO, when I came to that decision point after Mr. Smith. Well, when I made that decision, I didn't know where to go. I didn't know what to do, and I certainly didn't know anything about leadership in healthcare. Matter of fact, in my younger career, I only knew doctors and nurses. I didn't know all the different things that were in healthcare, which is what we try to preach today, and let individuals know that there is more than just being a doctor or nurse. But my point is, I immediately at that point I reached out to our system CEO. Just cold called him and said, you don't know me, I don't know you, but I want to be you one day. And in order to do that, would you be my mentor? And fortunately, he took the call, and then two, he became my mentor at that point in time. And that was in my professional career. The importance of that is that they're not going to. A mentor is not always going to give you the answer, right? They're going to help you through the journey, maybe some of the things that they experienced, kind of guide you. As an example, if you want to be me, you need to go back and get your MBA, and walk me through what an MBA versus an MHA was, and help guide it. One thing he told me at that time, he says, I'll definitely be that, but I'm not going to come to you. You're going to have to come to me, which kind of shows how bad do you want it, and then show some things that would say that you have a sense of urgency to be able to get there as well, and some ownership to it.
You know, my next question I'm not going to ask because I know the answer to it.
All right.
And that next question is, have you ever mentored someone? And so I know that I call you one day after my son is getting into a healthcare career. Will you spend time mentoring him? And you're without a thought, you said yes.
Absolutely. No, and the answer is yes. I have several that I'm a mentor to, and it's probably one of the most rewarding things. I go back to my experiences of how individuals help me, and I owe that to individuals that need my help as well. So pay back or pay forward, or however you want to say it, is something that is extremely important. I think that is critically important, and you won't have all the answers, but you know, it may be one thing that you say to that individual that helps them through that course, and you can help just guide them. So I thoroughly enjoy that, especially your son.
Yeah, thank you. I appreciate that. I'm curious, do you have a hero?
Wow, yes. The answer is yes. And you think about some folks that may have a superhero, and that could be your Superman or your Batman, or you have sports figures that could be your hero, or it could be a music icon that's out there that's your hero. But my hero is my dad.
Oh, okay.
My hero is my dad. Always has been, and he's my best friend, and everything that we do a lot together. But the main reason is not only did he teach me how to be a man, he was there every step of the way. He's a high school principal, superintendent, and he actually was my high school principal when I was coming up. But really took the time and helped me understand what a proper education meant. How to handle yourself in certain situations, and actually took that time to help develop me, and until today still does the same thing. So when I look at a hero as someone that's going to help shape you who you are, it's going to help you make you want to be better at who it is that you are, and every corner I turned, he was that guiding force and man for me that not only held himself in the proper way, was a true family man along the way, and treated my mother right, treated my sister right, treated our family right, and the dynamics around that. Professionally did all the right things as well, and helped guide me through it and stuck to it. So that's my hero.
Now, we're going to have to make sure your dad hear this, right?
I do.
So
I will.
make sure he gets this podcast so he can hear it. And I have one final question. Do you have a mantra or quote that speaks to you as a leader?
Be true to yourself. Be true to yourself. And why that's important to me is because there can always be challenging times. There are always things that are going to come at you every step of the way, and it can make you deviate from what your focus is overall. And when I say be true to myself, is no matter how much money you make or the things that can distract you to do other things, you always go back. I'm a young individual from Flint, Michigan that kind of grew up there and always wanted to make a difference. And so trying to give back and humble myself to make sure to be true to who I am as an individual helps guide me and keeps me focused. So that's me.
Well, Clarence, thank you so very much. I have spent some time with Mr. Clarence Sevillian, who is the Executive Vice President and COO of Prisma Health System. And Clarence, thank you so very much for spending time with Below the Line.
No, thank you. It's been a true pleasure.
The Below the Line podcast is brought to you by the University of South Carolina Upstate. Look for our monthly write-up in Greenville Business Magazine, and for more information, go to uscupstate.edu.